Hello, friends. Welcome to the Transforming Stress with Dr. Ash podcast. And today's episode is really exciting. In the last couple of years, all of us have been hearing about AI, artificial intelligence, and it's very exciting. A lot of people uh, say that it's the new fire. Equally, there are a lot of people who are worried about it. And I've myself followed the landscape and been using AI in healthcare. So to break this myth, a lot of myths, a lot of confusion, I wanted to get an expert, somebody who has been navigating this landscape for 40 years, 4 decades. AI in healthcare. Daniel Byrne is a faculty of AI in healthcare, and he is the person who is going to help us take the help us to understand what is the evidence and what is the myth. And please help me welcome Dan Byrne. Thank you, Dan, for joining us from Johns Hopkins.
Well, thank you for inviting me. Yes, AI has become incredibly powerful. And I think almost everybody agrees that the area of society where we're going to see the real benefit of AI is in healthcare. But the big question is, why is there almost no rigorous evidence that we're seeing AI is improving patient outcomes? There's a lot of talk, there's a lot of weak evaluations, but the big question is, when is it going to help patients? And that's been the focus of my work.
Thank you, Dan, for doing that very important work, because medicine is a field where we cannot have any error, because an error means life. And whilst there is a lot of excitement, there are new tools, there are lot much promise. And I know you are asking the question, what is the evidence, what is the evidence that this is going to improve improve the patient outcome. So then we have got listeners from 56 countries, from all over the world. So they are not just doctors or healthcare professionals. We have got a huge wide audience who are very much interested in learning this landscape, because this is where the future is. And I know you've been in the data sciences for 4 decades. Now, after spending like decades looking at data, looking at numbers, what can the numbers and data tell us even before humans understand that there is a problem?
Yeah, so that's the important question. And what the real benefit of artificial intelligence in healthcare is that it can predict things much more accurately than humans, and it can predict things much sooner and upstream. So our current healthcare system is very reactive. We catch things when they're too late, and humans are not that great at predicting a lot of complex things. And Daniel Kahneman won the Nobel Prize for his work in this area. And if anyone hasn't read his book, Thinking Fast and Slow, it's a fascinating book to read. But he showed that humans are very, very confident in their predictions. They're just not very good at prediction. And in healthcare, there's so many areas where we ask doctors and nurses to predict things that are really not humanly possible to predict. So they'll do their best. But now we have these AI tools that can predict things much more accurately. Well, I'll give you an example. So, a physician asked us to help build a tool to predict postpartum hemorrhage. And if people don't know what that is, after a woman gives birth, she can bleed to death or bleed excessively. And you might think this doesn't happen much anymore, but it does happen. It's a leading cause of maternal morbidity and mortality. So we built a very accurate way to predict postpartum hemorrhage. And then we also tested the doctors and nurses that do this every day and asked them, do you think this woman is likely to have a postpartum hemorrhage? And we showed they weren't much better than flipping a coin. So we implemented this AI predictive model into the hospital computer. And then we did something that almost nobody does that I think is the real key to the next level of AI in healthcare. And that's for 1 year, we performed a pragmatic randomized control trial. And that means as every woman who came through the hospital to deliver a baby, she was randomized to either usual care or usual care plus this model. And if the probability of postpartum hemorrhage was high, then there's a bundle to prevent it. So we're waiting to see at the end of this year. We'll look at the results, and hopefully this model predicted and prevented postpartum hemorrhage. And I think that's the key. We need to take these AI tools and test them, make sure they're safe. It could be unsafe. And is it effective? And is there a return on investment? So the same thing can be done for cancer, catching it upstream, blood clots, readmissions, and in your area, predicting stress, burnout, and suicide. We catch these things too late. AI tools can catch it much earlier, but we can't just give it a free pass. We need to test in rigorous science. Is this safe? And is it effective?
Very, very astute, Dan. And I was reading about your burn test because you are so passionate about uh, getting it right. And please correct me if I'm wrong here. That your colleagues in the corridor conversations used to say, "Well, does it pass the burn test or not?" And it is whether this tool is able to go through the test of fire and see whether this is going to going to work in the real world or not. And as Dan just mentioned, the same thing, because Dan, let me try to simplify this, and please correct me if I'm wrong. So what I've understood, whether it is research, whether it is clinical medicine, whether it is stress management, it is all about pattern recognition. Pattern recognition. Datas are continuously giving us patterns, and we see what these patterns are telling us, and how we can then gain insights and utilize these patterns.
Right. And that's why AI can go beyond human knowledge and predict things better. So, for example, when humans struggled to predict postpartum hemorrhage, they could only put a few inputs in their brain to compute that probability. But our AI model includes 21 predictors to look at that pattern. So it's a more complex pattern than humans can do in their head, and it does it fast and free. And there are patterns also in a mammogram that radiologists can't see. There are patterns in retinal scans that have amazed people at what the AI can determine with a retinal scan, an EKG. There are amazing things in the patterns that AI detects that humans have never even imagined you could tell.
And Daniel, that makes me the question with a lot of people and doctors and professionals are fearing: is AI going to take away their jobs, or going to replace them? And I will tell you, I will share with you my experiment which I did in the last 6 months. So what I did, that whenever I'm a internal medicine physician, so I am on call and I'm seeing complicated patient. Now, if I'm in a situation that I need to take advice from a specialist like a cardiologist or a respiratory physician, and thankfully I have got a place I'm working, I have got access to the specialists. So I see the patient and I know I need to speak to the cardiologist here, and these are the questions I'm going to ask. Now, before I do that, before I pick up the phone, in my mind I think, suppose I am working in a remote area, or I am working in an island where there is no access to the specialist. What can I do? So I open the phone and go to open evidence. 6 months ago, I anonymize all the data, and I would give that this is the situation I am, and I need some advice from the specialist. And the open evidence gives me the advice, and it makes, because I am an internal medicine physician myself, I am able to make sense of what the evidence or what the app is telling me, and then I speak to the specialist, and I have been amazed that the advice is so similar. And the other thing is that the AI has continued to improve. Now, unfortunately, open evidence is no longer working in Europe. So after speaking to you, I've started using Gemini, which is also equally good. But the main thing here is to give AI the context. So I am answering my own question that the human judgment has to be there, who's dealing with the patient or situation in front of them. So we this is getting better and better as times goes. So I wanted to hear from you about what the landscape is looking, and how do you foresee this shifting in the future.
Yeah, I don't believe AI is going to replace doctors, but the doctors who learn about AI will replace doctors that refuse to learn it, just like it always happens with new technology. There are people that resist learning new technology, and they're replaced by the people who are more open minded and learn the new technology. Um, and we really need a clinician computer symbiosis where we need the physician to do certain things and we need to let the computer do certain things. And we need the best of both worlds there. And that's part of Kahneman's research too. So, for example, we built an AI tool to predict hospital readmissions, 30-day hospital readmissions. Um, and it predicted very accurately. Now, some places also tried to have their AI tool decide what to do for the high risk patients, and they failed. So, what you need to do is have the computer do what it's good at, predicting which patients are likely to be readmitted, and then have clinicians decide what does that patient need who's a high risk, and then you get the best of both worlds. Now, you did point out that in some countries there's a lack of specialists, and we're going to need to use AI because there just aren't enough uh, doctors who are specialists. What one striking statistic, and you may know more about this than I do, but in India there's one pathologist for every 9 million people, and in a lot of countries, even in the U.S., there's a lack of therapists and rheumatologists. So we are going to have to use AI when there's a shortage of people. But I think the symbiosis is really the key to using AI effectively.
And how do you think this landscape is going to change in the next 5 to 10 years? Because you have seen how things have shifted in the last 40 years now. And how fast is the speed of change here?
Well, it's interesting. So AI is moving fast, but healthcare is notoriously resistant to change. So I think what's going to happen in the next 5 years is there's going to be a shakeout. There's a lot of people investing money in this. I don't know, $100 billion is being invested in AI in healthcare. There's going to be a shakeout. 80% of these startups and researchers and experts are going to fail. 20% are going to be successful. 20% of hospitals are going to be successful at implementing AI. They're going to reduce complications, improve survival. They're going to have much better results, detect things earlier. And then patients are going to flock to those 20% of hospitals that use AI right. And then the other 80% are going to be forced to change. And what are the 20% going to do differently? They're not just going to embrace AI, invest in it. They're going to really treat it like a new drug. And they're going to say, is this thing safe? They're going to test that first. And then they're going to test, is this effective? And they're going to do this. The Byrne test is really a pragmatic randomized controlled trial of AI improving patient outcomes, but it's done with a very high bar. And it's done in a way that if you get it right, you could go in the New England Journal of Medicine. So that means you have to pre-register it with clinicaltrials.gov. You have to do all of the rigorous steps to get the right answer. And that's really what the New England Journal of Medicine wants. They just want to know that they're not going to get burned. And if you say your AI tool improved patient outcomes, they're comfortable because you did all of the right steps there.
Thank you, Dan. Then now we are going to shift to another area of very much interest to me. And I know you mentioned about the book Thinking Fast and Slow, the type 1 and type 2 thinking. And I want to share that in the context of the physician and the healthcare burnout. In the United States that in the last 5 to 10 years, there have been studies every year which have said that there are 50 to 60% at least burnout rates in the physicians. And I think that all over the globe, the stats are not very different. But why do we see healthcare in other professions? According to the Gallup studies, every year the stats are very, very similar. Now, what happens in burnout, in that state of severe exhaustion, in the book Thinking Fast and Slow, what it talks about in the severe cognitive load, in the exhaustion, in the burnout, the thinking automatically shifts from the type 2 systematic thinking to the type 1 thinking. And the type 1 thinking has 10 to 15% of error rate. Now, if I tell you that you are going to fly, I'm flying you out to now give a talk, flying you from Boston to London, and the plane has a 10% risk of crashing and error rate, then you will not be able to sleep. You're not able to sleep. Now, aviation industry is the safest industry because what they have done at, with the systems approach and all the work which has been put in the safety, the landscape has completely changed, and medicine has to learn from it. But of course, the human factors are so much in the industry. So we are talking about how AI can help us as a great tool to cognitively unload the physicians, unload the healthcare professionals. And I personally found it to be a great tool over the last year in doing in working with as a Microsoft Copilot or a Chat for Health or Open Evidence or Gemini. So what are your thoughts about uh, the AI and the burnout?
Yeah, and so you make a good point that the aviation industry has become remarkably successful at being safe, and part of that is they've been using AI for a long time. And I have a section in my book about how the aviation industry is safer because they apply AI. And I think we can learn from that and apply AI to do things safer in healthcare. And burnout is a huge problem in healthcare and other industries. And AI can help with a lot of that. One area is with AI scribes so that physicians don't have to stay up late at night typing patient notes. And we can just take some of the administrative work off of physicians and allow AI to do it. But again, it needs to be studied. We need to make sure that's safe, and we need to make sure that is actually helping them. And people often skip the opportunity to do a simple thing like a pragmatic RCT of the AI scribes. That's an easy thing to test out. The other way that I believe we need to test AI in healthcare is stop pretending like it's a one and done thing where we just test it and we have one answer. We should be thinking about these things over the next 10 years. We're going to have burnout and stress, so we should think over the next 10 years. There's going to be various AI scribes and other tools, and we should do pragmatic RCTs over the next 10 years and just keep asking different questions in an adaptive platform trial where we drop arms that are not working and we add a new study arm that is working. And we keep asking questions in a factorial design, which just means that we can randomize in different ways to ask different questions. So we're really a learning healthcare system, and we're continuously getting better. And we apply continuous quality improvement to make the work safer and just more enjoyable for physicians and nurses. AI can help with so many administrative jobs in healthcare. For every doctor in the hospital, there are 9 administrators. 30% of healthcare is waste. AI can really help in a lot of these areas, and but we can't just be paying a lot of money for AI tools that maybe they don't work. We need to really evaluate if they do work.
True. So the future, if it is the future, if it is approached with caution and due diligence, looks very promising. And
And they'll
I can,
go ahead.
I can say that from my own experience that the work over the last 1 year, I have found a shift in both the cognitive load and all the learnings and all which is going into it, and I feel I can sense that it is going to go in a very very positive and a safe direction. Last time we were speaking then about and you gave the example of postpartum hemorrhage. You spoke about SLE. Was it SLE? Lupus. You talk about the tool you were developing. I would love for you to share about that because that is remarkable. That amount, and we know that so many times that there are missed diagnoses, there are delayed diagnoses. So, can you speak to more from a chronic health issues point of view?
Sure. So we have about 10 different projects going on now testing AI. But one of the ones that just passed the Byrne test is we had a physician who was a rheumatologist, and she came to us and she said, I need a way to predict which patients, once they have a positive ANA test, are going to develop an autoimmune disease like lupus. And she said, right now, rheumatologists are just overwhelmed and they can't really predict this. And the patients often go on a diagnostic odyssey, and it takes on average 7 years before patients get their diagnosis of lupus and other autoimmune diseases. And 7 years is a long time. And during that time, the disease eats away at their body. And so she asked, can we use AI to predict it faster than 7 years? So we worked with her, met with her every week, and we developed a way that once a patient has a positive ANA, we take their information and we put it into an AI tool to compute probability of an autoimmune disease. And then we did what hardly anyone does. We said for the next year, we're going to do a pragmatic randomized control trial, and we don't take anything away from anyone. Everybody continues to get usual care. So we randomized them to usual care or usual care, so people calm down. And then in one arm, on top of usual care, we're going to compute the probability of an autoimmune disease. And if it's high, we're going to send them to a rheumatologist. And we just closed out the study, and it significantly reduced time to diagnosis down to 43 days. And we have the paper. The New England Journal of Medicine AI journal gave us very positive reviews, and we're just wrapping up the reviews. And hopefully, in another month, we'll get this published. And that's an example of how you can do this right. Because often people will say, "Well, randomization is going to be too expensive, take too long. It's not possible." So we try to demonstrate with these projects examples that people can copy, and you could think of 100 other areas of healthcare where it's reactive, and you could use AI in a similar way, but then evaluate it and really prove it. Don't declare victory just because you have a model.
True, Dan. And the same thing can be applied to any chronic physical health issue. The same thing can be applied to any chronic mental health issue. So,
Yeah, suicide, stress, burnout. There's lots of opportunities to catch these things earlier.
much earlier. The pattern recognition much earlier. Now I see on your desk behind a copy of my book, The Boiling Frog,
Yeah.
sitting there.
Yeah, I've
So
really enjoyed that. It's such a great book. I enjoy all the quotes and the illustrations. And I was trying to think, how could AI combine with your workshops? And I was thinking, so let's say a medical center is interested in hiring you for some workshops and helping with the doctors. First, they could take an AI tool or something like our stress checkup, the 9 items there, and just have all of the physicians complete this. And the ones that have a high probability of stress or burnout could take your workshop. But then you could also take this to the next level and say, let's do this for a random half. And you could ask all the doctors, would you be willing to participate in a pragmatic randomized control trial? And the control group could be a delayed intervention, so they could get it next year. But that way you could test what's the impact of assessing burnout and then having an intervention. And that could be a landmark paper that really evaluates the evidence.
thank you, Dan. So the Boiling Frog is a full a decade worth of work which I have put my efforts into, and it's a systems based approach for stress management. And what it means that what if I take 100 people through this intervention, the everybody's answers are going to be different, because you see everybody's physiology is different, everybody's strengths are different, their values are different, their physiology in terms of their sleep and nutritional new aspects, and there are situations at work, the culture they are working in, there are so many data points into that. So a one size fits all approach is not going to work. That's why I created a systems based approach with the Boiling Frog. Now we are going to take it to a different level now with iFrog, which is put another level of the AI integrated into this. Because as you were sharing with me earlier, that it's all about pattern recognition. Stress is nothing but maladaptive thought patterns, maladaptive stress responses, of course, maladaptive cultures, maladaptive environments which are not right for the person. But again, it's all about the patterns, the pattern recognition in an individual, and understanding the patterns of workplaces, workforces, culture. So, the key to understand here is that it cannot be a one size fits all approach. It has
Yeah.
to be.
I think and that's the way it is with so many of these things like readmissions. The AI can predict who's at high risk, but then we need a human to customize it. Postpartum hemorrhage, the AI can tell who's at high risk, but then we need a physician to decide what exactly were we going to do for that patient. So almost all of these require that customized intervention. The AI is not good at that part. It's good at the prediction.
Now, Dan, if I get if I get the questions you drafted when you were at Vanderbilt, and you kindly send them to me, would you mind if I just speak to them?
No, sure. Yeah, when we were at Vanderbilt, burnout was an issue there. So the dean asked us to do a survey of all the physicians and assess what are some of the factors that are related to burnout and stress. And so we did this big study, and I analyzed the data, and I tried to uh, boil the results down into something that would be useful for people. And it boiled down to 9 things. And I tried to do it in a positive way so that people could go through these questions and see how many yeses do they get. So one question was, I get at least 8 hours of sleep on a typical night. Number two, I work less than 55 hours in a typical week. Three, I take quiet time for myself. Four, I feel satisfied with my workload. Five, I chose the right career. Six, I have an optimistic outlook on life. Seven, I regularly give and receive affection. Eight, I feel satisfied with my social/love life. And nine, I organize my time effectively. So these are all things that people can control. And if they have a lot of these where they can check them as yes, they're in good shape. But our healthcare system often has a culture that makes people think they don't even deserve to have enough sleep, and they should work too much. So, uh, a lot of the culture in healthcare causes some of these problems.
Very true. Coming back to this stress checkup questions, um, what I would like to ask you is that sometimes it might be very difficult for a no and yes answer. Sometimes it might be just in the middle. So how does one respond to that kind of a
Yeah,
situation?
so this would be, a good project for somebody to take up and take it to the next level. So they could take, um, how many hours of sleep do you get? And how many hours of work? Uh, Adding the continuous inputs could probably significantly improve it. But we wanted to keep it pretty straightforward, and this is what we were allowed to ask.
So one of the things I've been doing, like if you see that the Aura ring here or the Fitbit watch, so it gives a lot of indicators for sleep, really detailed indicators of sleep in terms of with how much is the total sleep, efficiency, restfulness, REM sleep, deep sleep, and based on that, it also creates something known as a sleep debt, and also creates your readiness score for the day. So sometimes if I'm in situations where I know, well, some stress is going in the environment, and I see that the sleep is starting to shift, my physiology is shifting, so the boiling frog model helps us to pick that drift
Mhm.
earlier. So if I see now that my readiness score is falling down or the sleep patterns are becoming more erratic, and the same thing can be applied for other physiological parameters, one can then take the intervention. You have have better sleep hygiene, um, work less, take more breaks. So that is where I feel that the personalized health data is also so helpful from a preventative point of view.
Mhm. Yeah, I completely agree. There's a lot of talk about personalized medicine and precision medicine, but we really need AI to make that a reality. And combining AI in healthcare will allow us to uh, truly use precision medicine, because it's not going to be possible to really implement precision medicine, personalized medicine, without AI helping.
So Dan, where do you feel that if in 10 years from now, what is your vision?
Well, um, I believe over the next 3 to 5 years, there's going to be a shakeout in healthcare systems, and the 20% are going to win and really use AI to improve patient outcomes. And then the other 80% are going to have to quickly change. In 10 years, I believe that AI will significantly reduce medical errors, reduce complications, catch diseases much sooner. Um, so much of our healthcare system is so reactive, and we catch things, heart attacks, multiple myeloma, complications, breast cancer. AI can catch all of these upstream, and then they're much more treatable and they're less expensive. And that will help physicians and nurses as well. It will be much less stressful to deal with things that are caught upstream and have AI helping with them. So I think AI will reduce the burnout and stress in clinicians. I think it will get even more powerful at being a tool. Um, but there's still challenges. So, for example, most people don't realize that up to half the medical literature is wrong. So, just summarizing the medical literature when up to half of it can be wrong doesn't really give you the right answer. So the next iteration of these tools has to critically interpret the medical literature, just like you and I would, and say, well, this one has a conclusion that I believe. This one is a completely flawed study. So there's still a lot of work to be done. The real work in AI is, well, first of all, there's a lot of resistance to change. So we need healthcare leaders to decide, I'm really going to help my institution use AI to improve patient outcomes. And then they're going to have to get involved in the weekly meetings to get past all of the obstacles and the bureaucracy and the politics. So I think the 20% of hospitals that succeed will be the ones where the leaders show up at the weekly AI model meetings and help that team really overcome the obstacles. Because without that, it's just impossible to get the data, build the model, change things. So you really need the CEO and the dean and the executives in these meetings, and then they're going to need some training so that they know how to lead. And that's another problem. We have people in our healthcare system who are leaders and paid a lot of money, and they don't really understand AI, and they don't really understand how to do their job in this new world. So we need some education. And we can't expect them to go back, get a PhD, and they don't need to do that. But that's one of the reasons I wrote my book, so that they could just read my book. And that's one of the reasons I teach these courses, so they can just take our online course when they have some free time and get up to speed on what they do need to know. And we don't need to teach them how to program in Python, but they do need some skills and they need to speak the language.
Dan, I really enjoyed reading both your books, like dipping into it, not cover to cover, but a lot of insights from the book, from the AI for improved patient outcome, and also publishing your medical research. So that is really amazing work. And do you mind if I put a link to those books here for listeners if they are interested in that? So one of the reasons I wanted to get you on the podcast, and we have been wanting to do this for the couple of months, and finally we did it today. I'm so delighted about that. Is it's the leaders, is the coming from the top. There has to be a culture change to embrace the AI and understand that though there are limitations and which are getting better and better, but we don't compare AI to perfect. What we compare is that, oh look, I'm working in this situation, I do not have an access to a specialist, and here we have got an AI who is getting better and better and is getting remarkable. And in my experience with the experiments I did, I had a very, very positive result. And as you said, that this is getting better and better as the years are going on. We are seeing that with Claude, we are seeing that with Gemini, we are seeing that with Chat for Health, Open Evidence, and so many tools out there. So the future really looks very promising. But then I did not want to deliberately go into the details, many technical details of LLMs, LLM evaluations, and the things which we learn in the John Hopkins course. I just finished actually this weekend, and it is such synchronous to have a conversation with you now. It was a great course. I would highly recommend anybody who's in healthcare to do the John Hopkins Healthcare AI course. I learned so much, so many things. It was a personalized, I would say, interactive course. where one could learn so much in just a 3 months time. So I am really, I feel I've really grown doing with the course. But of course, this is something which you have more and more hands-on experience. You keep getting better and better. So Dan, thank you so much for designing such a user-friendly and a student-friendly course. Now, one thing I'm before we finish, I was listening to your previous podcast, and I found it is very important to discuss that in especially on transforming stress. And the opposite of stress is joy, fulfillment, and happiness. And you were talking about the American dream, but because we have got a global audience here, we know people don't want to get burnout. People don't want to be unhappy in their lives. They want fulfillment. And where do you see the AI's role there in the coming in the coming decade? How can AI make people lead more fulfilled lives?
Yeah, and that's a great question. Well, first of all, thanks for taking our course. We have a new course coming out on August 1st. It's kind of a part two of that course that has a little more hands-on work for people that want to know how to make a model, and we have some synthetic data sets. I think AI can help people improve their lives in so many ways. Uh, it's not perfect, but as you said, our healthcare system is not perfect either. So,
Nothing is perfect, and in
yeah,
perfection is an illusion. If you see a magnet, then I don't have my magnet just now. If you see a magnet has a south pole and a north pole. So any system, whether it is a healthcare system or any kind of a system, will have their strengths and weaknesses. And if we want to take ourselves as a system, we will have our own strengths and weaknesses.
mhm,
The key here is to understand what our strengths are, how do we use our strengths, and understand the patterns of our weaknesses and how do we manage them. So I feel the answer is self awareness, how we can, with self awareness, understand that and continue to improvise.
yeah, and I think AI can make people's lives significantly better in so many ways. But we do have to be careful, especially with children and sensitive topics. But it can function as a therapist sometimes. Some people don't have access to a therapist, and um, or they might not feel comfortable talking to a therapist, and there's a shortage of therapists. So you can help out there, but I'd like to see some rigorous studies to make sure that's safe. It's great for everyday things, things break in your house and you don't know how to fix it, and you just ask Gemini or ChatGPT, and boy, it saves you, half an hour. And every day with your to-do list, you can think like, could AI really help me here? In medical research, it's enormously helpful, and it's gotten very, very sophisticated where, it used to catch a spelling mistake or a grammatical error, and now it's like the smartest person you ever met giving you advice. So I'd encourage people to experiment with Gemini and ChatGPT and Open Evidence, and just, ask it questions throughout the day. And the other way to handle this is on my phone and on my computer, I set up a folder and I put about six different AI tools in there. And I have them compete with one another and see like which one impresses me today with this job. And before I send out an email or an important letter, I'll cut and paste it and ask it to improve it, and then I'll take that version and paste it into another AI tool, and it's become remarkably sophisticated. It's really astonishing the level of intelligence that these tools are now providing, and they're just getting better. But for healthcare, like you said at the beginning, um, the saying of move fast and break things, that doesn't work in healthcare, because that's move fast and kill people. And in healthcare, we can't do that. We have to use these tools, but we We have to use them like a brand new drug. And and I've tried to demonstrate with my work and my teaching that it's possible to do it the right way. And the people that make excuses and say, oh, randomization is going to be unethical, take too long, it's too expensive, we've proven them wrong. And not everyone's going to listen to us, but the 20% that are going down the successful path will. The 80% that are going down the wrong path, they'll have short term success and then it will implode. So, everybody gets a decision at the fork in the road, and I can only encourage people to go down the right fork.
Thank you, Dan. So, no, I feel that the future is promising with caution, like with anything. When computers came 20, 20, 25 years ago, it's been a game changer. And the same thing with the AI. I think there will be much more quantum shift with AI, and it will be definitely a better, will be a definitely a better world. So Dan, we are coming to the end of our talk, and I'm sure we are going to meet again. Would you have any final message for the audience, and anything you would like to say from your experience and your learnings to share?
Well, I believe AI has become very powerful, and I believe it's really going to help our day to day lives, and it's really going to transform healthcare. But I think we do need to keep raising the bar and rigorously evaluate it, make sure it's safe, and make sure we do this the right way. We need to have a meter to know, is AI actually making things better compared to the way we used to do things, and the people that do that, I think it will reduce medical errors and complications, catch things upstream, and make life better for doctors and nurses and patients.
Thank you, Dan. And Dan, thank you so much for your support with the frog, with the boiling frog, and also your insights that how AI can be integrated into this, and we take it even to a higher, we've taken it even to a higher level. That not only the stress management is contextualized to the person in front of us, but also it's a dynamic thing. So where the person is today, he might not be at the same place next year. Life is happening to all of us, whether in personal life or professional environments, and different kinds of shifts are happening. So the boiling frog catches the drifts before they become much more serious. And the new version, the iFrog version, will have a layer, and I'm going to integrate what all I learned at the Johns Hopkins course into this to make this really better and better. So Dan, thank you so much for joining us at Transforming Stress, and also for the amazing work you have done in this area for last 40 years. And we know that your work is going to help millions of people all around the world. There's no doubt about it. The way the landscape is shifting, because here we are taking the globe into consideration, where there is no access to healthcare, where there is absolutely minimal access to the specialist. I can see where it is going. So it's really been a joy and a privilege to learn with you, and I look forward to our communications and collaborations in the future.
And thank you for inviting me, and thank you for writing those great books and providing that uh, great program. Burnout and stress is such a big issue in healthcare, and you're one of the leaders at fixing that problem. So thank you for all you've done.
Thank you, Dan. And as you said, that if AI is going to be used by physicians and professionals, and we don't want the burnt out professionals to use it, because if they use it incorrectly, that's what the result is going to be. So if they embrace it in the right spirit, it will help them to cognitively offload and have a better mental well-being. And those physicians then will, it's going to be a positive spiral of hope, of fulfillment, of achievement and day-to-day practice, your day-to-day experience of. And it's I know we are going a little longer, and it's not just about patient safety. In any, I would say, in healthcare and any industry, it is safety is one of the biggest parameters. But more than that, then there is a patient or a client experience. So the person who is coming to you, you would at least expect them to be smiling, expect them to be courteous.
Mm,
And if somebody is burnt out, they might not have that empathy, that care, that compassion
mm,
to give.
yeah.
Yeah. So I think it's a great direction we are taking it. And thank you for being a pioneer in this field. And I will look forward to our collaboration.
If you enjoyed today's episode, we'd greatly appreciate it if you could leave a 5-star review, a like, or subscribe on Apple, Spotify, or wherever you listen to your podcasts. Your support helps us reach more people looking to transform their stress into new comfort. We'd love to hear your thoughts, so don't forget to comment and share. For more tips and updates, please be sure to check out our social media links in the description box below. We can't wait to have you with us next time as we continue this journey towards turning stress into resilience. Remember, it's not the stress itself, but how we rise above it that defines our strength. So stay resilient and keep thriving, and we will see you next time.